Hello, everyone. My name is Adriana Hernandez, and I am a dietetic intern with Gulf Coast Dietetic Internship. Today, I will be presenting Managing Diabetes with Nutrition. There, these are the main points we're going to discuss today. I wanted to give basic information to those who are unfamiliar with diabetes and not overwhelm them. I understand that diabetes, along with other conditions, can be concerning when learning about it for the first time, but I am here to explain the facts about diabetes. Diabetes is a condition that affects the way your body uses blood sugars, also known as blood glucose. The pancreas is an organ that produces two very important hormones, insulin and glucagon. We know insulin is associated with bringing down blood sugar, but what about glucagon? Well, glucagon is made by the beta cells and it stimulates the liver to release stored levels of glucose to bring your blood sugar levels back up. An easy way to remember this is by thinking how insulin brings down blood sugars and glucagon brings up blood sugars. There are a few different ways to develop diabetes and biological reasons why, but it all comes down to insulin, the peptide hormone that helps the cells in the body absorb glucose into the bloodstream, which is used for energy. There are three types of diabetes: type 1, type 2, and gestational. However, we will also learn about prediabetes today. Type 1 diabetes is less common than type 2. In fact, only 5 to 10% of the people in the United States have type 1 according to the CDC. Having type 1 diabetes means A, your pancreas does not make sufficient insulin, or B, your pancreas does not make insulin at all, which means you will need insulin in order to survive. This is the most common type of diabetes, and it often develops in people over the age of 45, according to the CDC. Your pancreas may be making an extra amount of insulin to help your receptors react. Basically, your body stops responding to the insulin to help, which leaves you with high glucose circulating in your bloodstream, making you insulin resistant. Another issue is in America, childhood obesity rates are on the rise, along with cases of type 2 diabetes seen in children and teens. In fact, more than 75% of children with type 2 diabetes have a relative with it as well. This type of diabetes affects 2 to 10% of women each year in the United States. And just like type 2 diabetes, your body becomes resistant to insulin with gestational diabetes. If you are at a higher risk of developing this type of diabetes, your doctor will test you a lot sooner than the 24 weeks of your pregnancy. About 96 million adults in the United States have prediabetes, and of those, 80% of them are not even aware they have it. The good news is that prediabetes is reversible, but in order to do so, you will need to follow some lifestyle changes. Race and ethnicity are also contributing factors to prediabetes. In fact, higher risk populations include African Americans, Hispanic or Latino Americans, American Indians, Pacific Islanders, and Asian Americans. These are the common symptoms associated with diabetes, according to the CDC. However, symptoms do vary from person to person. These are the three P's of diabetes. You can experience one or all three in combination. If you are experiencing any of these, I do recommend you seek medical care soon to rule out the possibility of diabetes or any other underlying conditions. There are different tests your doctor can perform to learn more about your blood glucose levels and if you can be diagnosed with diabetes. These are the four main tests, and they all require a blood sample taken to be tested. After receiving results from your blood test, pay attention to the numbers, which will indicate where your blood glucose levels stand. Important numbers to remember are those with an A1C of 5.7 or below means normal, 5.7 to 6.4% means prediabetes, and an A1C of 6.5% or above means diabetes. And your A1C is a measure of your blood sugar from the past 2 to 3 months. It is imperative to check your blood sugars throughout the day. Talk to your doctor if you have trouble taking your own blood sugar, taking your medication, or if you need the dose of your medication to be adjusted. Living with diabetes means major adjustments to your lifestyle, including what you eat. Opt for nutrient dense foods like fresh fruits and vegetables, lean proteins like chicken and fish, whole grains like brown rice and wheat bread. Limit or avoid items with trans fat, saturated fat, added sugars, and added salt. These types of food include processed food, potato chips, fast food, marbled meats, and cakes, just to name a few. As you learn more about the necessary diet changes, try following this plate method at your next meal. Fill one half of your plate with non starchy vegetables like salad, broccoli, spinach, green beans, or even bell peppers. For the other quarter of the plate, add carbohydrate rich foods like rice, pasta, or even fruit. And for the last quarter, make sure you have a lean protein source like chicken, turkey, or even fish. Make sure to drink plenty of water to stay hydrated. Zero-calorie sodas, sparkling water, and flavored waters are also acceptable choices. Carbohydrates are meant to provide us with energy. The foods we eat have carbohydrates, which include sugar, starch, and fiber. When it comes to eating carbohydrates, try having more complex carbs such as legumes, potatoes, yams, and whole grains, instead of simple carbohydrates like soda, syrups, added sugars, and cakes and table sugar, items with those sorts of things. For best practice, try having the same amount of carbs for each meal. A good rule of thumb is to stay between 45 to 60 grams of carbohydrates for every meal. This includes your breakfast, lunch, and dinner. And one carb serving is 15 grams. In all, it is important to minimize the modifiable risk factors like weight control, diet, exercise, and smoking in order to prevent diabetes. Modifiable risk factors include those you can control, as stated earlier. Previous studies have shown a correlation between cinnamon and lowered glucose levels. In this study, conducted in 2013, adult participants had an intake of cinnamon for several weeks. The results showed improved glucose levels and improved cholesterol levels for these individuals. However, there is not enough evidence to conclude these benefits for everyone today. These studies were conducted roughly 10 years ago, so current research on this topic is needed. To learn more about diabetes, check out these resources below to stay educated. And I want to thank you all for watching my presentation on managing diabetes and nutrition. I urge you to see your primary care provider if you suspect having diabetes. Remember, although diabetes has no cure, it is manageable. Don't let diabetes stop you from living your best life to the fullest. And I will leave you with this quote. This is an infographic I created called Diabetes Healthy Tips for You. And it basically just goes a little more into depth about which vegetables are appropriate to eat, which are better than others, carbohydrate rich foods, again, which choices might be better than others, sources of lean proteins like chicken, fish, and eggs, and why it's important to hydrate with water. However, I do include other alternatives like zero-calorie sodas. This is another infographic I created, ways to prevent diabetes. Here I included a little bit of the statistics from the CDC and the World Health Organization, just to get a little background about diabetes. These are the key actions you can take in order to prevent diabetes as best to your ability. such as weight management, diet modifications, and physical activity and lifestyle changes. Again, these are the modifiable factors that you can control and ensure that you can prevent diabetes as best possible.